Well, coming down the pike, and one of the reasons I've spent some additional time talking about that, is not only that I really believe it's important to understand that background information about vaccination and smallpox, but is this going to come down the pike to us a little bit more? Because there's all sorts of things in this day and age after 9/11 that we're constantly reading about these bioterrorism things, and will it ever become mandatory? Well, if it does, in the case of a smallpox emergency, there will be absolutely no contraindications regarding vaccination of a person that is of high risk to smallpox exposure. Now, when you go through the contraindication list has always been things like people with cancer, people with immunosuppressive diseases, people with HIV that are HIV positive, people that are on high doses of steroids and immunosuppressive drugs, people that have had organ transplants. All of those are listed as, and people that are pregnant. All of those things are listed as contraindications to the vaccine. But there is now a declaration, and this comes directly from the CDC, that there will be absolutely no contraindications. Everybody will be vaccinated, and that will be period end discussion. And I know that when I was at the CDC meeting that I've been referring to in 2002, I talked to Dr. Orenstein, who used to be the head of the CDC, and I had a little sidebar with him, and I said, gee, I think if I was a betting person, I would bet on the 70% survival rate instead of the 30% death rate, if that is a real number. And if I were really a high-risk person and I had a lot of health problems, I think I'd take my chances with whether or not I was going to, A, get smallpox, because that's not a given. You know, if they're having an outbreak of the flu or they're having an outbreak of strep or something at school and you send your kids to school, not 100% of the kids get it. So first of all, it's not a given you're going to get it. And second of all, I'd bank on the 70% survival rate and see if there wasn't something else that I could do to support my immune system. And he said, no, absolutely not. We'll just vaccinate everybody and deal with the complications later. And that was just exactly what he said. And I paraphrased it a little bit, but not much. So this is coming down the pike. There won't be religious exemptions. There won't be philosophical exemptions. If you're in an area that the government perceives to be high risk, there will be no absolute contraindications to that. What is a more rational thing to think about with this? I mean, because this is a pretty irrational approach, I think, from a pure medical perspective. Well, I think a more rational approach would be to, let's say that you were in a stadium, football stadium, and some terrorist sets off something that people think is smallpox. Well, there's a 17-day incubation period. First of all, not everybody's going to get exposed, but let's say that you want to try to, keep things to, you want to quarantine those people. Well, put them in their house and monitor their temperature. If they get a temperature somewhere in the next 2 weeks that it is suggestive of the development of a smallpox infection, but it may not be. It might be the flu. It might be strep throat. It might be anything else, but it could be that. Then you may want to keep particularly that person isolated. And the other thing that the CDC says for sure in their document is that vaccination up to 17 days after a known exposure may prevent or ameliorate the infection. So these are the people who are big-time pro-vaccine and want to vaccinate anybody are already saying that we really don't even have to vaccinate you until 7 days after an exposure. So why this big push to go out and vaccinate, 500,000 healthcare workers and all the military? You can even do it after an exposure, even if you're pro-vaccine and even if you think vaccination is going to help. However, during the current laws and the political climate, probably all of the close contacts may be forced to be vaccinated, and there's some legislation in the works that has been sitting out there called the Model State Emergency Health Powers Act that they tried to push through in 2001 that has provisions for mandatory vaccination. Now, I want to be clear about this. That is not currently law. There is no law currently about forced mandatory vaccination. However, the legislation has been drafted. It's not been passed, so it's been sitting out there. It could happen. That's a very real thing. So what can we do about that? I mean, if you really don't want to have that little bifurcated needle and have all that stuff sort of jammed into you, what can you do? What are some choices to try to protect yourself? The other thing that's important for this is like people who maybe you've got a relative or a son or a husband or somebody that's in the military, and they're going to be forcing these vaccinations on these people. What is something that can do to sort of protect yourself? Well, this is a little protocol that I came up with. Now, this has not been tried in a double-blind placebo-controlled trial. There's no absolute scientific evidence that this is going to work. It's just that based on knowing physiology and knowing how things can help protect you. Because smallpox is a viral vaccine. It's a live virus vaccine. So what can you do to protect yourself from viruses? Well, the two main tools in anybody's toolbox that anybody can get their hands on pretty easily is vitamin C and vitamin A. And so if you take high doses of vitamin C 5 days before the vaccine, the day of, and 5 days after, you've got as much antioxidant, antiviral protection on board that you can get. I mean, you can really boost up your immune system with that. There's a whole protocol talking about taking vitamin C to bowel tolerance. Bowel tolerance means that you get powdered vitamin C and you keep taking additional doses about every half an hour until your body is completely saturated. When you get completely saturated, what ends up happening is you start to get a little bit of diarrhea. So that's how you know that you've got enough on board. With children, and I would say kids up to probably 12, you know, that they look like, you know, they're sort of that average size, you can give up to 10 milligrams per pound a couple of times a day. The other very strong antiviral is vitamin A. Again, to pre-treat 3 days before, the day of, and I would say for a couple of days afterwards. You can give adult doses of 100,000 units a day for that short period of time without any concern or any fear about liver toxicity or any other types of problems. Most people's vitamin A levels, if we were to get blood tests on everybody right now, would probably be low anyways. So to boost it up short term like that, there's no health concerns with that. The same thing with children. The other thing is that we know the smallpox virus is very susceptible to alcohol. So, and because this is not an injected vaccine like a measles would be or a flu shot, they actually take a little needle, and the needle looks like it's got a little pitchfork on the end of it, and they go and they jab it into your arm like 15 times until they make your arm bleed. So a possible way to sort of minimize the amount of viral exposure and anything that may be left on the surface of your skin is go wipe it off. You know, run, don't walk to the nearest bathroom and take some little alcohol swab and wipe off the residual that might be there. You might want to try something like maybe a warm mineral oil poultice or something like that to sort of try to draw some of that out. The other thing is colloidal silver. That's another natural sort of substance you can get at the health food store, and that is known to be a very strong antiviral, and that you can take a couple of teaspoons of that over the next couple of days. So those are some things that, just from an overall health perspective, offering obviously no guarantees, but can certainly help your immune system support it while it's being, if you have to be subjected to the smallpox vaccine. So another little thing about that, a little bit of an update, is that, like I've been saying, is this is not an issue that's going to go away. The vaccine is a live virus vaccine. It's thought to have been developed from, it's a genetically engineered vaccine. It's vaccinia. It's not smallpox. It's not cowpox. It's vaccinia. And vaccinia comes from the pox family of viruses, of which there's, I think, 15 or 20. And it's believed historically that the vaccinia virus that is used in the smallpox vaccine was genetically manipulated from an extinct horsepox virus, is how they originally made it. And that they believe that there's some cross-reactivity to the antibodies that you get from injecting vaccinia that will protect you from smallpox. So that's sort of the issue about what's in the vaccine. It's, and what's happening in terms of they continue to develop the vaccine. In fact, we spent $780 million a couple of years ago. It's almost $1 billion with a B. $780 million to develop the smallpox vaccine. And if you might all recall, you know, Tommy Thompson had said, who's currently head of HHS, that he wanted to have a vial of smallpox vaccine with every man, woman, and child's name on it across the United States. He wasn't exactly kidding. Okay, and so these are some things that are still coming down the pike, and this is as recently as March of this year. This is a new paper that came out, Vaccinia virus developing drugs to mitigate complications from the vaccine. Okay, this guidance provides recommendation on the development of drugs to be used to treat complications that may occur from the smallpox vaccine with the Vaccinia virus. It's intended to help commercial and research sponsors plan and design appropriate non-clinical and clinical studies during the development of these drugs. This guidance does not make recommendations about the development of drugs to treat smallpox. So the anticipation here in the pharmaceutical world is that we're going to be using this vaccine. We're going to have a lot of complications with it, and so we need to develop a drug to treat the complications because the likelihood of really having smallpox is pretty small. Or we would be developing drugs to treat smallpox, which is not what we're doing. We're developing drugs to treat the complications of the smallpox vaccine. So this isn't going away. And so you may think that this is sort of historical information. It's not. It's up-to-date information. In fact, it's so up-to-date that they have this thing now called Operation BioShield, that lawmakers have passed legislation to give private companies $5.6 billion in incentives to develop antidotes to biological and chemical weapons. Okay? Over the next 10 years, Project BioShield Act will give the pharmaceutical industry the financial guarantees it says it needs to research and produce vaccines and antidotes for bioterrorism agents that otherwise would have little marketable value. So this isn't going away, and it's really important for you to kind of know this. And why is it really important? Because you need to be vigilant about protecting your rights here. And if you don't know this, and if you're not up on this and know that this is coming down the pike, what can you try to do to organize your church, your schools, your communities, and things like that to say, you know, I don't want to do this. And the only way that this is ever going to stop, or it's ever going to get changed, or we're ever going to be able to do anything about it, is from a grassroots up. It's too big and too much money. It will never be top down. It only comes from each one of you and your families and your friends and your communities to say, we need to be aware of this because this is what's coming. This is hot off the presses stuff.